Well, thermal LipiFlow is a treatment that warms the eyelids from the eye outwards rather than from outside the eye inwards. And eye specialists say it's a more effective way to get the oil glands opened up and flowing better in patients with dry eye disease. Tears are made of three components: water from the tear ducts, mucus, and oil to maintain the moisture. But in patients with dry eye disease, often there's a lack of oil.
And when your eyelids come together, the glands, which are like finger-like projections in your eyelids, do this, and they actually tease and draw the oil out of the glands. So your blink is meant to push oil into the ocular surface.
Maury Adams has an extreme case of dry eyes, but nothing she tried helped until she tried thermal LipiFlow last December.
It was like the best Christmas present I'd ever had.
LipiFlow is a technique in which a device placed on top of the cornea gently heats up the eyelids to 42.5 degrees Celsius, opening up the oil glands and allowing any blockages to clear. Dr. Richard Maharaj also uses a massage on the eyelids to help get the oils flowing.
That complete evacuation of each gland is not something that's available by any conventional means. So this is very groundbreaking technology.
Edda Pivota says it's not painful at all.
It felt like suction cups, but after a few seconds, I kind of got used to it. It doesn't feel as bad as I thought.
In the past, heat applied from outside the eyelid could be used, but Dr. Maharaj says the amount of heat required to penetrate the skin and blood vessels of the eyelid was very uncomfortable. Eye drops can help some patients, but Dr. Maharaj says in the long term they can cause more problems.
Some of the eye drops actually contain preservatives, and the preservatives in those drops can actually damage the corneal surface as well as the lid surface.
Heaters in winter and air conditioners in the summer can aggravate dry eyes, so can texting and computer use when eyes blink up to 50% less, reducing flow even more. LipiFlow is typically effective 9 to 15 months before another treatment is needed, and it's not covered by OHIP. The price at $750 per eye is not cheap, but for patients with moderate to severe dry eye, it's often a price they're willing to pay. Now, patients who have inflammation of the eyes or an infection are not suitable for LipiFlow, and while it's been successful for a large number of patients, Dr. Maharaj says there are a few in whom scarring and oil gland deterioration are too far gone for LipiFlow to work. With today's Lifetime, I'm Pauline Chan.